While healthy lifestyle changes are the foundation of managing fatty liver for many people, they don't replace proper medical evaluation. Because fatty liver often develops without obvious symptoms, regular checkups can reveal problems long before they become serious. That's why healthcare providers look at the whole picture rather than relying on a single symptom or one blood test. If fatty liver is suspected, your provider may begin with routine blood work to check liver enzymes. It's important to know that normal liver enzyme levels do not always rule out fatty liver, and elevated levels do not automatically mean permanent liver damage. To better understand what's happening, your provider may recommend an ultrasound or, in some cases, a FibroScan. This specialized test measures liver stiffness and can help estimate whether scarring, known as fibrosis, may be present. Depending on your health history, additional tests for blood sugar, cholesterol, triglycerides, and other metabolic conditions may also be recommended because these problems frequently occur together. If you already have type 2 diabetes, obesity, high blood pressure, or high cholesterol, keeping those conditions well managed is one of the most effective ways to support long-term liver health. For some people, prescription medications may be appropriate, not because they directly clean the liver, but because improving blood sugar control, reducing cardiovascular risk, or treating obesity can also benefit liver health. The right approach depends on your individual medical history and should always be discussed with a qualified healthcare professional. It's equally important to recognize symptoms that require prompt medical attention. Yellowing of the skin or eyes, severe or persistent abdominal pain, vomiting blood, black or tarry stools, increasing confusion, extreme drowsiness, or significant swelling of the abdomen or legs are not typical signs of early fatty liver. These symptoms may indicate a more serious liver problem or another medical emergency and should be evaluated immediately rather than treated at home. The encouraging news is that most people diagnosed with fatty liver are not facing an emergency. When identified early, many have an opportunity to improve their liver health through consistent, evidence-based lifestyle changes combined with appropriate medical follow-up. The goal isn't perfection, it's making steady progress before long-term damage has a chance to develop. And that brings us to perhaps the most important message of all. What truly matters isn't finding the fastest solution. It's building habits that your liver and your overall health can benefit from for years to come. If there's one idea to take away from today's documentary, it's this: fatty liver doesn't usually develop overnight, and it rarely improves overnight either. The encouraging news is that your liver is remarkably resilient. For many people, consistent lifestyle changes, supported by medical guidance when needed, can reduce liver fat and improve overall health over time. The goal isn't to chase perfection or believe every miracle cure you see online. It's to build habits you can realistically maintain month after month. If you're living with overweight, prediabetes, type 2 diabetes, or high cholesterol, don't wait until symptoms appear. A simple conversation with your healthcare provider, along with the right tests, can give you a much clearer picture of your liver health. And if you've already been diagnosed with fatty liver, remember that even modest, steady progress can be meaningful. Every healthier meal, every walk around the neighborhood, every good night's sleep, and every positive choice adds up. Your liver works quietly for you every single day. Taking care of it isn't about following a perfect 30-day challenge. It's about creating a healthier lifestyle that lasts long after those first 30 days are over. If you found this documentary helpful, consider subscribing for more evidence-based health videos designed to turn complex medical topics into practical information you can actually use in everyday life. Until next time, take care of yourself, stay curious, and remember that small, consistent steps often lead to the biggest long-term changes.